welcome to Health Exposures. I'm Deborah Arneson, your host for the evening, and tonight we have a great guest. His name is Aaron Bartz. I'm sorry, Aaron.
That's okay.
And he's with us all the way from Wisconsin. He is a manufacturer's rep for orthomolecular products, which I use in my practice, and he has a wealth of knowledge, and we're going to be talking tonight about arthritis. And I know so many of you suffer from arthritis out there, and it's a constant debilitating pain for so many people. So we welcome Aaron, and thank you for the time that you took out to drive down here in traffic and give us some good information on how people can help themselves from this debilitating disease.
Thanks.
Let's start with arthritis. What is it?
Arthritis basically refers to an inflammation. It basically is the most common form of arthritis would be osteoarthritis. Most commonly it's seen in the elderly, not exclusively, but most commonly. Surveys have indicated that 80% of Americans over the age of 50 have osteoarthritis. That encompasses about 40 million Americans.
Wow, it's a lot.
Yeah, it's quite a big number. And there's other forms of arthritis too, but osteoarthritis seems to be the most prevalent or common. The other forms could be rheumatoid arthritis or gout.
What's the difference between osteo and rheumatoid and perhaps gout?
Well, rheumatoid arthritis is more of a autoimmune disease where it involves the immune system. Osteoarthritis has more to do with degeneration of cartilage. That's kind of the difference between those two, and those two would be the most common.
What's the pain variance? I mean, how does pain from rheumatoid affect an individual versus the osteoarthritis?
Well, they're in rheumatoid, well, actually in osteo it would affect more of the weight-bearing joints. You would in the hips, the knees, the fingers. Rheumatoid arthritis could also show up in the crippling of the fingers and that type of thing. They're similar in some ways, different in other ways. The way you treat them is different, though.
It is. So what precipitates it? What causes osteoarthritis?
Osteoarthritis is being more thought of nowadays as more of a deficiency state rather than a overuse problem. For years we've thought of it as they were maybe
joint abuse.
Yeah, joint abuse or misusing it, and now it's being thought of more as it could be a deficiency in multiple amount of nutrients.
Does joint abuse, like somebody who's extremely athletic, actually precipitate, though? I mean,
yeah, it could be a contributing factor, definitely.
Okay. All right. So what kind of nutrients are missing?
One of the most common, well, if someone has osteoarthritis, there's a number of different things they would do. One I would recommend is taking a high-potency multiple vitamin, which most of the patients you deal with or most of the general public could benefit from taking a high-potency multiple vitamin. And kind of on that topic, some things to look for in a multiple vitamin are high-potency B complex. Some of there's probably thousands of different multiple vitamins on the market. You go into a health food store, you'd be overwhelmed.
You're confused, yes. So what do you consider high potency in the Bs?
75 milligrams or higher, 100, 150 milligrams, especially like on your B6, B12. B12 would be in micrograms, but 150 micrograms.
And would that be because the Bs assist in utilizing the protein more efficiently?
Right, and so many people are deficient in B vitamins. It seems to be one of the most common deficiencies.
It is.
The other things you look for is minerals, and you want a multiple vitamin that's high in the minerals. And this is kind of a personal recommendation, but I think that most people should look for a multiple vitamin where the magnesium is as much as the calcium or even double the calcium, because so many people are deficient in magnesium. I meet with a number of doctors, and if I ask them what's the #1 mineral deficiency you see on your labs, they say, I mean, 90% of them will say magnesium right away.
Yes.
And it's because most of the American public doesn't eat the green leafy vegetables, a lot of the foods that are rich in magnesium, and we're assuming that those foods would even contain the magnesium. You know, the soils are so depleted of a lot of the good minerals that we don't even know if it's there.
So when we see all those little mustache commercials, it's not necessarily calcium that all you folks need, it's magnesium.
And magnesium helps the body utilize calcium better. Your body may, if you don't have enough magnesium, you could be misusing calcium. It could be being placed in the arteries, plaquing in the arteries, that type of thing.
That's really good information to know that if you take calcium and you don't utilize it well, it's not being well absorbed, you create you know, all kinds of vascular problems. You can create
your body essentially misuses the calcium rather than
muscle problems, achy muscles. It just collects in different places. So what causes the pain of osteoarthritis?
The pain of osteoarthritis is caused basically by the degeneration of the cartilage, and then there's bone spurs that form, or hardening that forms, and that's what causes the inflammation.
Which
and the
is
pain.
a calcification of calcium trying to heal the place that's inflamed,
That's
correct?
Right. That's right. And actually cartilage is supposed to act, it's supposed to have a gel-like nature and protect the ends of the joints. But when that cartilage starts to wear away and decrease, then you get bone on bone. And that's actually where the pain comes from, some of the deformity and the limitation of motion, that type of thing. So it's important to give your body the nutrients necessary to keep that cartilage thick and lubricated.
So how does someone know if they actually have osteoarthritis? How do you diagnose this?
Well, x-rays,
Symptomatology?
symptoms, x-ray can indicate that. I mean, I've seen x-rays that different chiropractors that I deal with have shown me where cartilage is almost, you know, non-existent.
Zip, huh?
Right, right. So that's...
And that'll lead to some serious breaks too, right?
Right.
I mean, premature aging in many ways. So what is the conventional medical treatment for osteoarthritis?
The conventional treatment is the use of what's called non-steroidal anti-inflammatory drugs, or in short term called NSAIDs. And NSAIDs are basically things like aspirin or ibuprofen. And more recent, these things are used very common in the United States. That's the traditional approach to them.
There's aspirin abuse going on here.
Right, and they seem to alleviate some of the symptoms. But actually, more of the recent research is showing that they're suppressing the symptoms, but they're not actually helping the root cause. They're actually, some of the studies have actually shown the use of ibuprofen and some of the non-steroidal anti-inflammatory drugs is actually progressing the disease, rather than you know, pushing it the other way.
So they're finding that ibuprofen and aspirin actually help to accelerate joint destruction in some cases?
Right. They're suppressing the pain so the person feels better, but it's actually accelerating the disease, which, if you think about it, means that people, they would be better off not doing anything at all as far as taking ibuprofen or aspirin if they could live through the pain. Now, that's probably not practical advice for most people, but by taking those things, they're actually accelerating the disease.
Well, here's the deal, too, Aaron. I mean, I just did a study for a drug depletion seminar I did out in California a couple of months back, and we found that aspirin in and of itself and the ibuprofens robs the body of 6 different minerals and 3 different B vitamins. So we're coming back to the same focus you said earlier, that we're missing magnesium, manganese, zinc. You know,
so not only are you deficient because maybe your diet's not there, you're getting robbed on the other hand.
Right, you've got a highway robber coming in and sticking up your body, taking out everything we need. Right, so that makes good sense. Well, in addition to the acceleration of joint destruction, what other harm can the anti-inflammatory, or the, what are they called, non-steroidal anti-inflammatories cause?
A lot of gastrointestinal problems. Some people complain of headaches, dizziness. Those are some of the common symptoms that are associated with overuse of them.
From abusing them?
Right, and for that reason, they should really, I won't say people should never use them, but they should be used for short term. And that's why they're not a good answer for osteoarthritis, because osteoarthritis is a chronic degenerative disease.
So again, the difference between osteoarthritis, for people who just tuned in, and rheumatoid arthritis is what?
Basically, osteo deals with more of the cartilage, whereas rheumatoid is an autoimmune disease.
So it's more joint pain?
System. Yeah,
they
both have some similar symptoms. It's just the way they're treated is differently, because rheumatoid arthritis is basically an autoimmune disease where your immune system is attacking itself, whereas the osteoarthritis is more of just a degeneration of the between the
friction
joints.
Between the joints. Okay, gotcha. So what do we do here? What do people do who suffer from this? What do they need to take?
There's basically 4 things that would be a good start. the high-potency multiple vitamin that we already talked about, more antioxidants because free radical damage, which is from a lot of the environmental toxins, that type of thing, will also contribute to...
Like what kind of antioxidants? We'll pretend some people out there know nothing about antioxidants.
Antioxidants would be like vitamin C, vitamin E, vitamin A, selenium.
And what types of foods should support those antioxidative therapies as well?
Well, for arthritis, I know certain foods you would want to avoid. I'm not sure. Maybe that's
vitamin
more
C
up
is
here.
in fruits, yeah.
Right.
Okay.
Right.
Vitamin E would be our fish oils and our seeds and nuts and things like that.
Right.
Raw foods usually.
Right. The other thing, supplement-wise, would be something like flaxseed oil. Flaxseed oil is high in what's called omega-3s, or your good fats. Now, a lot of people may eat at McDonald's or fast foods, and they're getting a lot of bad fats, a lot of your saturated fats.
And low-quality protein,
Right.
which really is not absorbed well.
That's right. And they need more of the good fats. The good fats have natural anti-inflammatory properties, and since osteoarthritis is inflammation is involved there, that would have some benefit. And the last thing is a substance called glucosamine. And if anybody's followed some of the mainstream news the last couple of years, they probably heard about glucosamine. There was a renowned book called The Arthritis Cure that was written by a medical doctor out of Arizona, and he talked about glucosamine, chondroitin sulfate, some of those other things.
Well, I'm sure that most people are like, what's glucosamine? Yeah, where does it come from? Where do we get it? So what is it?
Glucosamine basically is a combination of glucose, which is the body's main fuel source, and an amino acid called glutamine, and that's what makes up glucosamine. It's a natural substance. Glucosamine is actually found in your body, and its purpose is to provide things called glucosaminoglycans or proteoglycans, and that's not so important to know those names, but basically what they do is they're proteins that bind water, and that water helps we talked about the muesli, the gel. It helps the cartilage keep its gel-like nature and its shock-absorbing qualities, and that's basically what glucosamine's purpose is, so that you can actually reestablish that cartilage.
How many forms of glucosamine are there, and how do they vary, and what do they do?
Okay, the three most common forms of glucosamine are glucosamine sulfate, glucosamine hydrochloride, and then there's an ingredient called N-acetylglucosamine. To kind of make it easy for everybody, N-acetylglucosamine really does not have much benefit as far as cartilage regeneration.
But how would a consumer know that when they go to buy this product?
Right, they wouldn't. I mean, they would need to read and become educated on it. Basically, N-acetylglucosamine is used better for things that are GI-related, gastrointestinal related, like leaky gut syndrome, food allergy problems, that type of thing, because it's taken up in the gastrointestinal system rather than dispersed to the joints. So it basically leaves us down to glucosamine sulfate, glucosamine hydrochloride. And anybody who's followed nutrition over the last couple of years would see that there's two camps on this. Some people say glucosamine hydrochloride, some say glucosamine sulfate. Really, I'll tell you, if you're getting a pharmaceutical grade, a purified form, a high quality of either one, it doesn't matter. Both are shown to be dispersed to the joints at about 98%.
That's great.
So it tells you that it's getting to the place where you need it. And
well, sulfate would be more of an anti-inflammatory in and of itself, wouldn't it be?
Yeah, and some people think you need the sulfur molecule. I don't know.
To bind to the protein?
Yeah, the sulfur. Well, sulfur alone. Some people with arthritis benefit by taking sulfur alone, and that may have some validity to it. I don't know how much. Our approach from where we come is we've looked at both of them, and glucosamine sulfate is a mixture of glucosamine hydrochloride and sodium or potassium sulfate, and so you're getting less glucosamine because you're mixing it with another molecule, whereas glucosamine hydrochloride is 98% pure glucosamine. And in a lot of the research on joint and arthritis and that type of thing has indicated that what you want is more glucosamine. The more glucosamine you can get, the more the body can produce those proteoglycans and those glucosaminoglycans, which help with retaining the water and the gel-like nature of the cartilage. So we would actually, if someone had to really press me and say, what what source would you choose? I would say glucosamine hydrochloride, just because you're getting more glucosamine per your dollar, and there's less chance for unambiguous label claims. There can be a little play with glucosamine sulfate, and for those elderly patients, which this is the group that's taking this, there's no sodium in the glucosamine hydrochloride. Glucosamine sulfate has glucosamine and sodium chloride.
Okay, you guys, so glucosamine hydrochloride is the best source for the people, especially who have blood pressure or sodium processing problems. Okay, tell me this. If people go into a health food store and they, tell someone I want glucosamine sulfate, I know sometimes now they mix it with glucosamine with chondroitin sulfates. What's the difference? I mean, do the two work better together? Is it best to take one alone first and see how that benefits you? And how long do you need to take it to see benefits? Yeah,
that's another, there's a little argument on which glucosamine should be used. That's another argument as to whether you should use it with chondroitin sulfate or just use glucosamine
That's why I asked the question.
Glucosamine, with chondroitin sulfate, what we've seen initially, it would be better to use them together. And then once you start to see improvement and benefits, which usually takes 4 to 8 weeks, then it would be possible just to switch to glucosamine by itself for economic reasons. And really, after you get the initial benefit, glucosamine is what you need long term.
And what is chondroitin sulfates? What is the derivative of that?
What chondroitin sulfates does is it basically acts as a liquid magnet to draw water into the proteoglycans, and that's important because you have no direct blood flow to the joint, so it's the action of the water that brings the nutrients into the joint, keep the joint from becoming malnourished and brittle. And also, chondroitin sulfate inhibits certain enzymes that like to eat at cartilage, causing premature damage.
Oh, really?
So it has some benefits. The big argument of those that say don't use chondroitin sulfate is that it's a large molecule, so the absorption on it
is minimized.
Is minimized. I can tell you from just the number of doctors I've talked to that have used both, say that initially it helps to have both of them together, and that the patient seems to get some faster results.
For 6 to 8 weeks, use the chondroitin sulfates and the glucosamine hydrochloride together. Do you carry a product like that?
Yeah, the product we carry is called Chondroflex, and it actually adds another ingredient in it called bromelain, which is just in there for some inflammation reasons. Bromelaine's an enzyme that comes from pineapple, and if you eat lots of pineapples, you get some anti-inflammatory
could get too
effects.
Acidic then,
Yeah, you could get too acidic. But bromelain will help with some of the inflammation.
Well, that's good to know. So when a person takes this, because a lot of people start on a product and they don't see benefits like in a week or 2 weeks. I mean, the most important thing that I could tell the consumer, and I'm sure you as well, is you need to really be faithful in your usage to see the benefits. So I found in the world of nutrition, I don't know if this is true for products, but if you have a problem and it's been in existence for 10 years or 12 years, it literally takes a quarter of that amount of time to completely heal the body. It doesn't mean you won't get good benefits, you won't see increased energy, you won't see decreased pain within 8 to 12, to 16 weeks. But it's at least a quarter of that amount of time that you've been in hot water to get out of the hot water to where it's not even lukewarm.
That's exactly true, and that's a lot of people. When you're talking nutritional supplements all the way across the board, not just this topic, people don't realize that too much. Our society is
quick fix.
Quick fix, yeah. I mean, everything we do is quick. I mean, you go to the gas station, you get gas, you can pay at the pump. It's quick.
Yes.
And that's the way people think about their health, is that something's
Give
wrong.
me a pill.
Fix it tomorrow.
Right.
And that's not realistic. And this, with using the glucosamine, the studies have shown it does not, when we go back to ibuprofen or some of the aspirin, things like that, those things are more suppressing the inflammation, but they're not regenerating cartilage, they're not fixing the problem. And when we go to the root of the problem and say we want to actually regenerate cartilage, you're not going to do that taking a pill today and it's going to be fixed tomorrow. It's going to take some time. And actually, that's how the pain relief occurs as far as osteoarthritis. Glucosamine and those things are not painkillers. Glucosamine actually regenerates cartilage, and that's how you get the pain relief. It's not just killing the pain. So it's the way we want to approach health. but it takes some time, and some people,
Right.
you know,
It's like lose the Band-Aid on the boo-boo mentality, and, you know, get to the crux of the problem and explore it and stick with it. I mean, I had a woman who came in today, Aaron, and I know you probably hear about this all the time because you deal with so many health practitioners, but she's been back to see me 3 times in the last 3 years, and she comes and she starts and she stops and she starts and she stops, and you know, she's very upset and she's, you know, sad and very, very, you know, nervous. And I said, listen, you have no follow-through.
Yeah.
You know, you will not see benefits, but I've done this for a week. You know, I'm like, a week is nothing. You know, this is nothing. And you have been this way, you tell me, since you were 12 years old. You're now 40-something, and you got to stick with it. And be very faithful to it, and be persevering. So people, you know, there are no quick fixes, but there's some pretty fast fixes.
Right.
I see people heal in 8 to 12 weeks. Considerable healing goes on in a short period of time. It's just lose the magic bullet mentality.
Yeah. And they can probably see a majority of their symptoms improve within a couple months. There's going to be some that are going to take longer, but they can feel a lot better. You know, 50% more healthy in a couple month period.
Right.
If they will be consistent with what they're doing. And in this, particularly in this subject, that's very important because of the philosophy behind trying to regenerate the cartilage. There's no other way than to be consistent with the supplementation and on a daily basis over that period of time. If you're erratic, or you don't do it, or you do it for a week and then stop for 2 weeks, the benefits are really going to be minimal.
So the really good news here to our viewing audience, for our viewing audience, is that there's a resolve to this, because for years there was no way around this other than taking anti-inflammatories.
Right.
So, and a lot of people were doing steroids, which is even worse, which really chews away at cartilage, doesn't it?
Yes.
It just degrades it very quickly.
I've seen over the last, you know, really 3 or 4 years where this has really become even accepted by a lot of orthopedic surgeons.
That's great.
Where, I mean, and that's not to say that we need their stamp of approval, but that's what they deal with on a daily basis. And a lot of them are even recommending this to their patients before they pursue surgery.
Sure.
I had one doctor who had a patient that had pretty severe osteoarthritis in the knee, and she was going to have, she had actually already been to her surgeon with scheduled surgery, and he said, as a last resort type thing, he threw her the information on glucosamine and said, read it. If you want to try it, I've got it. You know, it would be worth a shot. And she wanted to go for it, and so she did. And she went on it for 8 weeks. Her surgery had been scheduled further out, and she ended up canceling her surgery. She had such dramatic benefits.
Oh, that's great.
And that's probably the exception. A lot of times when you get to surgery point, there's almost, you know, virtually no cartilage to regenerate. But that gives hope to a lot of people.
That sure does.
Rather than just taking painkillers.
Well, that brings us to another question, because a lot of people that I see are pretty much trepid about approaching their physicians or their doctors and talking to them about alternative methods for healing their bodies. So what I generally tell my clients is, you know, you need to have a conversation with them. I'll give you the handout and educate the doctor.
Sure.
So, you know, it's up to you, the patient, to be your own doctor and to be proactive in your caretaking of your own body.
Right.
So, you know, if a doctor doesn't know, and once he reads the studies, I know that, you know, front and center, ears are up, they're pretty much attentive to it.
And glucosamine is something where it's not something that there's been a few handful of studies done on 3 people. It's something that there's been over 300 clinical studies and double-blind, placebo-controlled studies on glucosamine, most of them done in Europe or Italy in particular. But this is something where if you look for the documentation on it and you wanted to get the documentation to your physician, it is there.
It's on the web.
Yeah, and that's not true on all nutrition, but I can tell you this is one area where if you want the documentation, it's there.
It's available.
Yeah, there was a study done actually comparing ibuprofen use to glucosamine.
My next question.
In an 8-week study.
Really?
And,
so what was the comparative findings?
The comparative finding was basically initially the first few days, the pain scores, or the pain basically, reduced faster in the ibuprofen group, and that's basically because that's what it's doing. It's suppressing the pain and inflammation.
Right.
But after a few days, the glucosamine was starting to show reduction in pain, and by the 4th week, the pain scores were identical. So it took 4 weeks, but they were identical. And at the end of the 8-week study, glucosamine was more effective as far as relieving the pain than the ibuprofen was. And beyond that, I mean, that's a good benefit in itself, but beyond that, it actually, they showed through viewing the cartilage electron microscope reversal of cartilage degradation. So
That's
it was
amazing.
regenerating the cartilage.
So you can regrow your cartilage, folks.
Right.
It's amazing. Yeah. It is amazing what they're finding out when they're starting to deal with whole products, you know, that we find in the body available, being made, hopefully, if we haven't abused ourselves too much. But tell me, cartilage can regenerate, and they've known that for how long now?
Well, a lot of more recent studies have been over the last 4 or 5 years, but it can regenerate, and one of the more recent studies showed a 37% improvement in thickness of cartilage.
That's great.
And that was done by using ultrasound to measure the thickness. So they've been
even in really, really old people?
Yeah, I mean, I would tell you if we go back to length of time, I said about 4 to 8 weeks. I have seen in my conversations with different physicians around the country that it takes sometimes up to 6 months for those over the age of 65. It just seems like there's a little less cartilage there.
6 months over 65.
Yeah,
What about hydrochloric acid? If people are low in like hydrochloric acid and some digestive enzymes, would it help for them to take something like that, some pancreatin and digestive enzymes, just to help with absorption?
Yeah, we would always, that's pretty general on a lot of nutrition, is that if people aren't digesting things properly, which you can probably say is most people.
Yeah, 99.9%.
Then it would be useful to fix their digestion and then, you know, put them on nutrients.
And get
like
some
this.
live foods in there, huh? That aren't adulterated.
That's right.
Okay, so the results in an average person would be about 6 to 8 weeks, where they start to see some reduced inflammation and irritation, and they have some relief. How much a day do they have to take?
Of glucosamine, they need at least 1,500 milligrams.
And how much is an average pill?
Well, most commonly out there is 500 milligrams, so they would take it 3 times a day. There's a couple companies out there that have as high as 750 milligrams, so you can cut it down to 2 per day, which most people like to take less capsules.
Sure.
So
do the results stop then, Aaron, once the glucosamine has stopped as well?
If someone were to stop taking it, the results will lessen over a period of time. The benefits are largely retained, but this is something, especially if you're talking about a chronic disorder and age-related, that type of thing, that they're probably going to need to take some supplementation continually.
Is it cost prohibitive?
No, not really.
Okay,
no, it's,
good. And if it takes 4 weeks for the glucosamine to work, then what can they do in the interim to relieve pain? Okay,
there's a couple things. One, we meant to talk about bromelain a little bit. Bromelain would be a good natural anti-inflammatory. Rather than taking the aspirin or some of the ibuprofen, take bromelain. And pancreatic enzymes would also be helpful. Those would be
help with absorption.
Right.
Are there any other things that individuals can do to relieve their osteoarthritis pain, in your opinion?
Diet-wise, they could avoid milk because vitamin D causes sore joints.
That's good to know.
They could. They should avoid like citrus fruits, that types of things in the diet. Tobacco, salt.
Why citrus?
Red meats. Citrus can aggravate or cause more inflammation, and they should get regular exercise. And exercise like swimming or walking, not
something
not
gentle
things,
on the joints.
not things that are stressful on the joints.
Okay, great. Well, Aaron, our time is up, but I want to thank you. This was a wealth of information. Thank you for being with us. You're wonderful.
Thank you.
You have some great information to share. So there's hope out there for all of you arthritis sufferers. So join us next time. We'll have Aaron back next week. We're going to be talking about prostate problems. So until then, take good care of your health. And I'm Deborah Arneson, wishing you the very best of health. Good evening. You were great.